Microorganisms are defined as minute living creatures that are too small to be seen by the naked eye. Some microorganisms have no effect on humans, but many are beneficial. Other microorganisms cause disease and are called pathogenic. These disease-causing microorganisms surround us and are easily spread directly from person to person or indirectly from animate and inanimate objects to humans. Disease or infection occurs when a pathogenic organism invades a human body whose resistance is too low to fight it off. Although antibiotics are used in the treatment of many infections, the best method for infection control is to prevent the spread of disease-producing microorganisms. In addition, your infection control goals include attaining conditions free of pathogens and educating your patients as to how they can help control the spread of pathogens. The objectives of this video are to describe factors necessary for the development of the infectious process, to describe the body's natural defense mechanisms, to differentiate between medical and surgical asepsis, to demonstrate the hand-washing procedure, and to demonstrate universal precautions for blood and body substances. Infection begins when a high concentration of pathogenic organisms invade the body. The most common pathogenic organisms which cause disease are viruses, bacteria, fungi, and parasites. Viruses are the smallest pathogens and can only be observed with an electron microscope. They cause flus, colds, mumps, hepatitis, and AIDS, just to name a few. They attach themselves to a living cell and take over the cell's normal metabolism. The invaded cell continues to make new cells and new viruses. Finally, the invaded cell bursts, dies, and releases numerous viruses which then can invade other cells. Bacteria are single-celled microorganisms which can readily multiply outside of living cells. Bacteria can be cultivated on artificial media and are visible under a microscope using proper staining techniques. Once identified, bacteria can be classified by shape and appearance, and it can be determined if the bacteria is a disease-causing agent. One type of bacteria are the common pus-producing microorganisms found in pimples, boils, and suture abscesses. Other forms of bacteria cause strep throat, rheumatic heart disease, scarlet fever, gonorrhea, pneumonia, meningitis, tuberculosis, tetanus, diphtheria, cholera, and syphilis, to name but a few. Fungi are unicellular or multicellular and appear in the form of molds and mushrooms, as well as in microscopic growth. Fungi are responsible for athlete's foot, ringworm, thrush, and also some vaginal infections. Parasites are organisms that live in or on other organisms. Protozoa, which are single-celled microscopic parasites, cause diseases such as malaria and trichomonas, an infection of the vagina. Another type of parasite, metazoa, which are multicellular organisms, cause pinworms, tapeworms, and trichinosis in pork. A pathogenic organism, whether it's a virus, bacteria, fungi, or parasite, must have a place in which to grow and reproduce. This area is called a reservoir. Reservoirs that support the organism may exist in soil, in water, or on equipment. However, most reservoirs are found in human beings and animals. Pathogens commonly exit human reservoirs through what are called the portals of exit. The pathogen can exit through the respiratory tract in secretions from the nose, nasal sinuses, nasal pharynx, larynx, trachea, bronchial tree, and lungs. The intestinal tract through discharge in the feces, the urinary tract through discharge of the urine, and the reproductive tract through discharges. Pathogens can also exit through the skin or mucous membranes. Open lesions are discharges on the surface of the body, the blood, and across the placenta in pregnancy. After an infecting organism has left its reservoir, it can cause a new infection only if it finds a way into a new, susceptible host. The pathogen may be spread to a host by direct or indirect transmission. In the case of direct transmission, the organism passes from one person to another. This may be done through inhalation, through sexual contact, or by direct contact with an open lesion. Indirect transmission occurs when an organism which is capable of surviving for a period of time outside the body is transferred to a new host by an animate or inanimate vehicle. Inanimate vehicles are any non-living objects or substances such as water, food, air, clothing, bed sheets, or instruments. An animate vehicle is a person who touches contaminated material but doesn't wash his or her hands and then carries the microorganism on the hands to a susceptible host. The infecting organism enters the new host through what are called the portals of entry. The main portals of entry include the respiratory tract, the gastrointestinal tract, the skin or mucous membranes, the urinary tract, the reproductive tract, the blood, or across the placenta in pregnancy. Even if a pathogen enters the body, disease or infection may not develop. The body has natural physical and chemical defense mechanisms that act as barriers against the pathogenic invasion. The body's natural defense mechanisms include the skin, mucous membranes, the respiratory tract, the gastrointestinal tract, the blood, and the lymphoid tissues. The body's largest barrier against infection is the skin. As long as the skin remains intact, it creates a physical block to a tremendous number of microorganisms. Chemical barriers of the skin, such as sweat, inhibit bacterial infection. The mucous membrane holds many microorganisms in check because of the repelling forces in the secretions that bathe these membranes. The respiratory tract defense mechanisms include the hairs and moist membranes lining the nostrils and the cilia lining the bronchi, which carry mucus and foreign materials to the throat. Also, the natural reflexes of coughing and sneezing help remove foreign matter, including microorganisms. In the gastrointestinal tract, hydrochloric acid in the stomach and bile in the small intestine serve as chemical barriers to many disease-producing agents. The blood and lymphoid tissues contain and produce cells and antibodies that are able to exert tremendous influence in protecting the body against disease. When any foreign substance, such as toxins and microorganisms, invade the body, they are called an antigen. The body identifies the antigen and generates specific antibodies that help deactivate that particular antigen. Antibodies are protein substances that help combat infection. This process is called the antigen-antibody reaction. The antibodies assist in destroying the pathogen through one of several means. Antibodies can neutralize the antigen, they can rupture the microorganism's cell membrane, or they can weaken the pathogen so that it is vulnerable to attack by cell-eating organisms called phagocytes. When antibodies are produced in sufficient quantities, the body builds its immunity to the disease or infection and is able to resist further infection by the pathogen and its toxins. Immunity is the resistance of the body to pathogenic microorganisms and their toxins. This occurs as a result of the antigen-antibody reaction. There are 4 types of immunity. They are active immunity, passive immunity, natural immunity, and acquired or induced immunity. Both active and passive immunity are produced by natural and acquired means. Active immunity develops when antigens are introduced into the body, such as from an immunization. Passive immunity develops when ready-made antibodies are introduced into the body, such as when the mother passes antibodies through the placenta to the fetus. Natural immunity is an inborn resistance to a disease due to antibodies that are normally present in the blood. For instance, some races are highly or less susceptible to certain diseases than others, and an acquired or induced immunity results from antibodies that are not normally present in the blood. For example, a person who has had chickenpox would not be susceptible again. In order to control and prevent the spread of disease, medical assistants must always use medical and surgical aseptic practices. Medical asepsis refers to the destruction of microorganisms after they leave the body. Surgical asepsis refers to the destruction of all microorganisms, pathogenic and non-pathogenic, before they enter the body. In this video, medical aseptic techniques will be reviewed.
The most important medical aseptic practice which breaks the infectious cycle is hand washing. Wash your hands before and after handling supplies and equipment, and before and after assisting with each patient. Hand washing must become an automatic part of your work. The importance of hand washing cannot be overemphasized. The entire procedure of washing your hands, wrists, and forearms takes 1 to 2 minutes, or 2 to 4 minutes if your hands are highly contaminated. Begin by removing your watch and placing it in your pocket. Or if it has an elastic band, move it higher up your arm. Turn on the water and adjust it to a lukewarm setting. Wet your hands and apply enough soap to develop a good lather. Vigorously wash your palms, sides, and backs of your hands using a rubbing motion. Wash between your fingers and around your knuckles. By starting with your hands and working your way up to your wrists and forearms, you assure the microorganisms on the hands won't spread upwards. Keep your hands pointed down and at a lower level than your elbows so that contaminated water won't stream up your arm. Wash your wrists and forearms as high as contamination is likely. Be sure not to splash water onto your clothing. Then rinse your hands, wrists, and forearms thoroughly. If using bar soap, keep it from getting contaminated. Hold the bar in your hand during the entire procedure, as the sink and soap dish are contaminated vehicles. If you drop the soap bar, rinse it off and repeat the hand washing procedure from the start. Bar soap should be used only when liquid soap or soap granules are not available. Clean under your nails with an orange wood stick or nail brush before starting work each day, and when your hands are highly contaminated. Rinse nails well under running water. Avoid letting the water run onto your hands. Then thoroughly dry your hands, wrists, and forearms with a paper towel. Use another paper towel to turn off the faucet if handles are present, because the faucet is considered contaminated. This step will secure the cleanliness of your hands. Use hand lotion as necessary to keep your hands from chapping.
You risk exposure to a number of infectious diseases when you come in contact with blood or body fluids. Practicing universal precautions can help protect you, your patients, and other healthcare workers from the danger of pathogens. Universal precautions include hand washing, wearing appropriate protective garments, properly disposing of biohazardous waste, safe handling of specimens, and thoroughly cleaning up equipment. The universal precaution of hand washing before and after direct patient care is the most important method of protecting yourself and your patient. But there are additional precautions you should practice as well. Whenever you're in contact with blood or body fluids, such as sputum or urine, wear disposable single-use exam gloves. You must also wear gloves when you have a cut or sore on your hand. This will protect both you and the patient from pathogenic invasion. When you are involved in procedures where blood or other body fluids may splatter, you should wear disposable single-use exam gloves, a fluid-resistant gown, goggles, and a mask or face shield. This equipment is referred to as personal protective equipment. When caring for a patient whose cough has not been diagnosed, wear a mask. He or she may have tuberculosis or another infectious disease. Using this protective equipment will help protect you and your patient. Another concern in controlling the spread of disease is the disposal of used needles. Used needles can spread disease, and their proper disposal protects you, the physician, and the janitorial staff from possible contact with blood through unexpected needle sticks. Take great caution when using or disposing of needles. Do not recap used needles unless absolutely necessary. If you must recap the needle, place the cap on a tabletop before inserting the needle. Insert the needle into the cap without holding the cap. Then tighten the cap at the needle hub or push the cap against a wall to ensure that the cap is firmly attached. Never lay a used needle down thinking you will take care of it later. Immediately dispose of the needle in an approved, rigid, puncture-resistant container. Do not use your hand to push it into the disposable container. If the container is full, arrange to have it replaced. Never try to remove a needle or syringe from the needle box. Never leave any needle or sharp instrument on the countertop, on examination tables, or on disposable procedure trays. All needles and sharps must be put in a rigid, puncture-resistant, leakage-proof container with a lid labeled with the approved biohazard label. Your facility may have special red puncture-resistant containers designated for used sharps. As you know, you will be responsible for handling specimens and decontaminating equipment. When you do, always practice universal precautions. All specimens from all patients must be considered potentially infectious and must be handled with caution. Always wear disposable single-use exam gloves when handling all specimens. Promptly clean up spills of blood and body fluids. Be sure to wear gloves. Clean large spills with paper towels. Place the paper towels in an infectious waste container. Do not place contaminated towels in a regular waste container. This could spread disease to others. Use household bleach, diluted 1 part bleach to 10 parts water to disinfect the spill area. In order to protect yourself from noxious fumes, do not use undiluted bleach for cleaning purposes. Non-disposable equipment must be sanitized after each patient use. First, put on heavy rubber gloves over disposable single-use exam gloves. Then put on goggles or a face shield and a fluid-resistant gown. Then clean and scrub these items with water combined with either a detergent, a blood solvent, or an approved germicide solution. Any non-disposable instrument which comes in contact with blood or other secretions must be thoroughly washed and sterilized. Equipment such as EKG leads or EEG electrodes, which come in contact with intact skin, need only be washed with detergent and water before reuse. Equipment such as a stethoscope or an otoscope must be disinfected after each use by wiping it off with gauze or cloth moistened with a disinfectant. Following the precautions used to break the infectious cycle helps promote a clean, safe environment for you, your patients, and your fellow healthcare workers. In this video, you have reviewed the stages of the infectious process, the hand washing technique, and universal precaution procedures for blood and body substances. As a medical assistant, infection control practices will be a part of your daily routine and will help keep you and everyone around you safe from infection. Disease or infection-causing pathogenic organisms are around us everywhere. Pathogens are easily spread directly from person to person or indirectly from animate and inanimate objects to humans. Disease or infection occurs when a pathogenic microorganism invades a human body whose resistance is so low it is unable to fight off the invading microorganisms. Medical and surgical aseptic practices are methods of infection control used to prevent the spread of disease and infection. Medical and surgical aseptic practices break the infectious disease cycle so that microorganisms cannot spread to and invade a susceptible host. Medical asepsis refers to the destruction of organisms after they leave the body. Examples of medical aseptic practices are hand washing, use of gloves when handling highly contaminated articles, and the cleaning of non-disposable equipment before and after patient use. Surgical asepsis refers to the destruction of all pathogenic and non-pathogenic microorganisms before they enter the body. The goal of surgical asepsis is to prevent infection or the introduction of microorganisms into the body. The practice of surgical asepsis is often called sterile technique. Sterile technique is used in all procedures where entry is made into normally sterile body parts, such as when giving an injection or during surgical procedures. Surgical asepsis, or sterile technique, is also practiced when an area and the supplies in the area are made and kept sterile. The objectives of this video are to describe and demonstrate the procedures for sanitizing, disinfecting, and sterilizing equipment. to demonstrate the use of chemical sterilization indicators, to describe the use of an autoclave, to demonstrate correct methods for placing supplies into and removing supplies out of an autoclave, and to describe methods for storing sterilized packaging. Sanitization, disinfection, and sterilization are the primary methods used for inhibiting and destroying microorganism growth. Each of these methods represents a different level of decontamination. Sanitization is the process of cleansing and scrubbing items with a blood solvent, detergent, or with chemicals. Sanitization must be done before items can be disinfected or sterilized. Disinfection is a procedure which destroys most, but not all, infectious microorganisms. Some resistant and spore-forming bacteria and some viruses, such as the hepatitis B virus, are not adequately destroyed through disinfection methods. Instruments and equipment which are not used on open skin surfaces are those that do not penetrate tissue but are used on intact skin or in natural body openings only need to be disinfected after being sanitized. If instruments are going to penetrate the skin or mucous membranes, or if used in procedures requiring sterile technique, then they must be sterilized. Sterilization is the complete destruction of all forms of microscopic life. Instruments or equipment to be sterilized must also be sanitized before sterilization.
When sanitizing contaminated items, wear safety or personal glasses with a solid side shield or a face shield, heavy rubber gloves with long cuffs over disposable gloves, and a plastic apron or fluid-resistant gown. To sanitize contaminated items, first bulk rinse them in water containing a blood solvent, low-sudsing detergent, or an approved germicide solution. This is done to clean off all debris, oil, blood, or grease. Next, rinse instruments in another sink or pan of fresh water. Then scrub each item thoroughly using a detergent and a hand brush, or preferably a brush with a handle so that you avoid hand contact with the instrument. Special attention must be given to scrubbing items with serrated edges, where blood or grease may collect. Using hot water, thoroughly rinse all detergent off each instrument. Remove excess moisture from the instruments by rolling them in a towel. Check that all articles are thoroughly clean and that they are in good working condition and alignment. In a well-lit, clean area, check that the serrations of each dry instrument meet evenly, that the instruments open and close easily, that all parts are present and intact, and that the ratchets close easily and do not spring open. If imperfections are found, remove the item and follow your agency's policy for dealing with broken equipment. Next, coat each instrument with a water-soluble lubricant such as instrument milk, which is a pre-lube solution to protect it from corrosion and to provide lubrication for the hinges. Air dry for 20 minutes. The instruments are now sanitized and ready for disinfection or wrapping for sterilization. Sanitization of instruments to be disinfected or sterilized may also be done by an ultrasonic device. Instruments cleansed ultrasonically avoid the need for hand scrubbing, thus avoiding the possibility of transmitting pathogenic microorganisms to medical personnel. Once cleaned in the ultrasonic device, instruments must be thoroughly rinsed in cold running water to remove residue, soil, or ultrasonic solution, which might inhibit sterilization or damage the sterilizer. Towel dry instruments to prepare them for disinfection or sterilization. Instruments and equipment such as thermometers, percussion hammers, and laryngeal mirrors are examples of items that must be disinfected. Disinfected items come in contact only with the patient's skin or shallow body orifices. Disinfected instruments do not come in contact with open skin surfaces or sterile dressing materials. Disinfection may be accomplished by chemical germicides or by boiling water. When using a disinfectant solution, follow the recommended directions. Chemicals may differ in their dilution ratio. If a solution is diluted too much, it will lose its effectiveness. Pour the chemical solution into a container with an airtight cover if necessary. Place the instruments in a tray, opening all instruments which have handles. Completely immerse the tray into the solution and close the cover if required. Leave the items in the solution for the required time. Exposure time may vary from 20 minutes to 3 hours or more depending on the chemical used. Correct exposure time is extremely important to ensure complete disinfection. When the correct exposure time has been met, with gloved hands, lift the tray out of the chemical container and rinse items in a pan of sterile distilled water. Chemical solutions are often toxic and must be thoroughly rinsed from the instruments before they are used on patients. Use sterile transfer forceps to remove items from the tray and place them in their specific work area. Certain items such as sphygmomanometers, stethoscopes, and ophthalmoscopes may be ruined if washed and immersed in any solution. Disinfect these items by wiping them with gauze or cloth moistened with a disinfectant.
Another disinfection method is to use boiling water. Boiling water is effective for disinfection, but it is not considered safe for sterilization. If your facility uses boiling for disinfection, familiarize yourself with their technique. The limitation of the disinfection procedure must be recognized. Disinfection procedures can be effective in controlling many forms of microbial life, but may not destroy viruses nor spore-forming bacteria. Disinfection procedures must not be substituted for sterilization. There are several methods which bring about sterilization. The most common method, and one of the most efficient methods of sterilization used, is steam under pressure, accomplished in an appliance called an autoclave. Remember that all equipment and instruments, before they are disinfected or sterilized, must be cleaned and scrubbed using the sanitizing procedure. Once the instruments being prepared for sterilization are sanitized, they must be dried and then checked to ensure that they are in good working order and in alignment. Then they must be wrapped or placed in protective coverings made of either clean muslin, cloth, special disposable paper or bags, or peel pouches and tubing. These materials are permeated by the steam or chemical vapors of the sterilizer, but not by airborne or surface contaminants during handling or storage. Hinged instruments such as hemostats are left open for sterilization. Containers with lids are sterilized with the lid off. Place these containers on their sides and the lid at the side or at the bottom of the container with the inner surface facing outward. Materials and instruments which are used together may be wrapped and sterilized together. To wrap items using cloth or disposable paper, place the cloth or paper on a surface so that the edges form a diamond pattern. Place items in the center. Remember to leave hinged items open. Fold the bottom corner up to the items and then double back a small corner. Fold the right side to the items, again doubling back a small corner. Fold the left side to the right side and double back that corner. The pack is folded up from the bottom. The top corner is overlapped and secured envelope style. Place this pack in the center of the second wrapper and rewrap in the same manner. The pack is then secured with pressure-sensitive tape. The package is labeled and dated. The pack should be firm enough for handling, but loose enough to permit proper circulation of steam. Rubber items require special care for sterilization. Immediately after use, rubber items are washed in cold water, then washed in warm water with a low sudsing detergent. All reusable rubber items are rinsed thoroughly, dried, and wrapped for sterilization. Instruments may also be wrapped for sterilization in disposable packaging materials. These materials include paper and pouches and tubing of paper and plastic. Disposable packaging is made of heavy-duty, wet-strength surgical-grade paper, which allows for steam penetration during sterilization. The paper also acts as a barrier against airborne bacteria during storage. Many of the disposable paper bags are printed with a temperature and steam-sensitive indicator, which changes color during sterilization to show that the item has been sterilized. To use disposable packaging, open hinged instruments and insert them facing upward toward the plastic film side through the top of the bag or pouch. Seal the pouch. Check the packaging for a pre-printed temperature and steam-sensitive indicator. Apply one if necessary. To prepare delicate instruments for sterilization, insert the instrument through the slots of a protector paper until the tip is completely covered by a plastic flap. Open hinged instruments such as scissors and hemostats. Fold the anti-lock flap forward between the handles of the instrument. For added protection, tuck the anti-lock flap into the topmost holding slot. Slide the loaded instrument protector into the sterilization pouch. The instrument should be facing up toward the plastic film side and not down toward the paper. Seal the pouch. Chemical sterilization indicator devices provide assurance that the parameters of the sterilization process were met. The indicators work on the principle that specially prepared dyes change color when exposed for a specific time to the high temperature and saturated steam in the autoclave. There are various types of monitors and indicators available for steam sterilization. One type is a disposable tag which is placed in the center of a pack. Sterilization conditions of adequate steam, temperature, and time are assured if the wide bar at the indicator end of the tag has changed completely from white to black. If it has not, the pack must be reprocessed and re-sterilized. Another chemical indicator available consists of 2 indicator bars covered by a clear plastic overlay. The indicator bars contain a pigment which changes only in the presence of steam, not just heat. Indicator bars change color only when conditions for complete sterilization are met. Autoclave indicator tape may be used to seal and label packages before sterilization. Dark diagonal lines appear on the tape after the sterilization cycle. These lines show only that the pack has been exposed to steam and the autoclaving process. But the other indicators we mentioned are superior to this tape. An autoclave sterilizes by heated steam pressure, usually at 250 degrees Fahrenheit. Length of sterilization time varies according to the item and whether the wrapper is made of paper or fabric. At 250 degrees Fahrenheit, average sterilization times range from 15 minutes for unwrapped items to 20 or 30 minutes for wrapped items. It is important to remember that a change in autoclave temperature or pressure, or too short of a steam cycle, may affect the sterilization process. items must be placed in the autoclave so that the steam can flow between the packs and penetrate them. To avoid the formation of air pockets, containers, tubes, cups, and similar items are placed on their sides. This allows cool air to drain out in a downward direction and then be replaced by steam rather than being trapped inside. Items wrapped in disposable paper bags are placed horizontally on their sides in the sterilizer tray. Place linen and dressing packs in a vertical position. When sterilizing linen packs and hard items in the same load, place the linen packs on top. This prevents water condensation from dripping down on the linen packs. No item should rest against plastic utensils. Otherwise, they may not retain their shape while being exposed to very high temperatures. Do not overload the sterilizer chamber. Place the articles as loosely as possible inside it. Leave a space between all articles and the surrounding walls in the chamber. Correct positioning and spacing of all materials will allow effective sterilization to occur when proper temperature, pressure, and time requirements are met. Failure of the indicators to change color completely denotes a serious lack of steam penetration into the pack. This is a warning that there may be a sterilizer malfunction or an error in the sterilization technique. Never neglect this warning. Some of the most common problems are improper loading of the sterilizer, faulty preparation of the materials, a faulty sterilizer, error in the sterilizer, or wet steam caused by an excess of water in the boiler or pipes, which causes items in the sterilizer to become wet. Check for an error in your technique. If the indicators still do not change color, it may be necessary to have the equipment repaired. Before you remove a load from the autoclave, read and precisely follow the manufacturer's directions for discharging steam from the sterilizer. Exhaust the steam pressure from the chamber. Steam under pressure may cause severe injury if the door is open before or during the exhaust phase. Once the steam has been exhausted, the pressure has reached zero, and the temperature is below 212 degrees Fahrenheit or 100 degrees centigrade, stand back from the door to avoid steam burn. Then, open the autoclave door slightly. Allow the contents to dry for approximately 15 minutes before removing them. If you open the sterilizer door completely, this allows condensation due to the outside cool air and results in wet packs. Some modern autoclaves have an automatic drying cycle. This eliminates a drying step. All dry, wrapped, and unwrapped items that need not remain sterile may be removed with your clean, dry hands. Check all sterilization indicators for proper changes in color. Remove unwrapped sterile items with sterile transfer forceps and place these items in a sterile environment or sterile storage container. Store sterile supplies in a closed cabinet or a closet which is clean, dry, and dust-proof. If the supplies are placed on shelves, the lowest shelf should be at least 8 inches from the floor. You may safely store sterile items wrapped in cloth or paper for 21 to 30 days. Items wrapped in envelopes with one side transparent plastic and the other side paper can be stored for 3 months. Wrapped items placed in sterile plastic dust covers may be stored for 6 months. When these time periods expire, all packs should be reprocessed and re-sterilized before use. Because of these time constraints, it is important you develop a system of usage that uses older supplies before the newer supplies. Also, set a time one day a month to check exam rooms and all cabinets and shelves for adequate inventory levels, expired package dates, and defective or contaminated packages. Remove any defective or outdated supplies and reprocess them for sterilization. You have been shown the methods for sanitization, disinfection, and sterilization of equipment you routinely use. Active practice of sterile techniques prevent the spread of microorganisms and protect the health and life of your patients and yourself.